In the beginning, the very beginning, before grocery stores, man faced terrible dangers and risks. Dinosaurs, active volcanoes, violent storms, mothers-in-law. Each day was an adventure where every walk into the open meant a chance encounter with a careless jogger. But somehow man survived these dangers. And now, we face the most horrific, terrifying threat to our survival ever. Understanding the modern-day healthcare delivery system. For instance, do you know the name of your PCP? Are you enrolled in a PPO or an HMO? How about a point of service? Have you considered an EPO? Or would you prefer the older, more established PHO? Are your claims paid by an insurance company, an HMO, or a TPA? Regardless of the healthcare system you've chosen, do you know when you're in network? Are your drugs listed on the formulary? Has your PCP ordered a brand name drug for your bronchial infection or a generic alternative? Does it matter? What is a copay? And why is it $10 and not $20? Co-insurance limits include any deductibles you may have, don't they? Confused? Worried? We thought so. That's why this video has been created, to solve the mysteries of your employer-sponsored managed healthcare insurance plan. Your Health Maintenance Organization. Your Health Maintenance Organization, or HMO for short, is designed to provide you with a comprehensive set of benefits for a reasonable fixed premium. Your plan may have a few small co-payments for certain services, but on the whole, most of your care is covered by your regular premium payments. Health care is directed by your primary care physician, referred to from now on as your PCP. Choosing your PCP is one of the most important decisions you will make regarding your health care. So establish your criteria and make sure your PCP meets or exceeds your expectations. Most HMOs carefully screen their PCPs prior to contracting with them, a process called credentialing. Your HMO checks their education and experience as a practicing physician. You probably won't find Dr. Frankenstein or Dr. Jekyll on your HMO's list of approved physicians. Competent PCPs might reasonably be expected to have graduated from a medical school requiring more than a large financial contribution from their great-grandfather, or from a school on a Caribbean island that only your travel agent has heard of. Also, don't be impressed by a football or basketball scholarship. Very few diagnoses are really made based upon whether or not your PCP sinks that 18-foot jump shot tomorrow night at the Y. And finally, make sure your PCP understands that anesthesia is most effective when used before a painful procedure, not afterwards. In an HMO, most of your health care is covered by your premium payments, and your PCP directs your health care. Your HMO might be a staff model, an independent practice association, a group model, or even a mixture. A staff model operates and owns medical centers. These centers come in all shapes and sizes, but regardless of their physical appearance, their purpose is to offer a wide range of medical care at one location. Many centers include their own X-ray, laboratory facility, pharmacy, and optical store. The Independent Practice Association, IPA, HMO, consists of private practice physicians who provide services to you in their own offices. You will be able to choose your PCP just like in a staff model from a list of physicians contracting with the HMO. Group model HMOs consist of groups of physicians instead of individual physicians. Mixed model HMOs may consist of any of the different types of HMOs. For example, you may be able to choose a PCP who works at a staff model center or a PCP who has his own private practice. HMOs can be staff models where doctors are employed by the plan, or independent doctors under contract to the plan. Or HMOs can be a mix of these. In most HMOs, your PCP will direct your care. The PCP is the quarterback, so make sure he knows the plays. Your PCP is responsible for all of you, not just certain body parts like most specialists, leading the rest of the team like nurses and dietitians. Your PCP's focus is on preventive care, health screening and early diagnosis so that you can live a long and healthy life and continue to pay your insurance premium. If you need the care of a specialist, if you have a heart problem, for instance, and need a cardiologist, it will usually be up to the PCP to direct your care to that specialist. You won't have to decide for yourself whether or not you need special care. Your PCP will know. What a relief! In the event you suffer an injury or illness which requires emergency treatment, something that is life-threatening, for instance, your HMO typically allows you to seek treatment at the nearest facility. And if you're out of the area, on vacation perhaps, and need medical treatment, your HMO provides coverage. So don't hesitate to take that boat ride in the Everglades. Just be careful when you do. And finally, with most HMOs, there are no claim forms to complete. Kiss that mountain of paperwork goodbye. Your primary care doctor's role is to keep you well by preventing illness through preventive care, health screening, and early diagnosis. Your primary care doctor quarterbacks a team of providers who take care of you. Your HMO provides all of your health care needs, even if you're out of town, and there are no claim forms to fill out. Predictable costs and quality medical care. Your health maintenance organization delivers. Your preferred provider organization. The easiest way to understand and appreciate your preferred provider organization, or PPO for short, is to keep in mind that a PPO is a team effort. And, like most teams, each member of the team has a different role. The first, and perhaps most important member of your PPO team, is the physician. Your PPO is contracted with various physicians to provide services to you. These physicians have usually discounted their normal fees to the PPO in return for a position on the team. They want to be on the team because they want to increase the number of patients they serve. So they charge the PPO less in hopes of seeing an increase in patients. Your PPO will provide you with a directory listing all of the physicians on the team. Some PPO directories are quite large, while others, well, others are somewhat thin. Another important team member is the hospital, or in many cases, hospitals. Again, the hospital offers the PPO reduced charges in the hope of receiving more patients. The key word here is volume. Increased volume means increased revenue. The next player on the team understands this concept especially well, that player being the pharmacy. Your drug prices will be extremely affordable through your PPO because the pharmacies playing on the team will offer the PPO very competitive prices in exchange for your business. Some pharmacies may even offer you the convenience of filling your prescription by mail. Those are the star players on your PPO team. But every team needs role players. So don't be surprised if your PPO includes surgery clinics, optical shops, and other specialties. PPOs are made up of teams of doctors, hospitals, pharmacies, and other healthcare providers who discount their services. Whenever you go to a team member, a preferred provider, you will receive the highest benefit provided by your healthcare plan. But one of the most popular reasons for choosing a PPO is freedom of choice. You do not have to use the services of anyone on the team. However, if you decide to go to someone who is not on the team, someone who isn't giving the PPO a substantial discount for their services, your benefits will be reduced, which may mean you will need to reach into your pocket for what could be a substantial ransom. Going to a team member is called staying in the network. Going outside the team is called being a traitor. Oh, no. It's called going out of the network. PPOs offer you the freedom to choose any provider within the network. Using doctors outside the network means reduced benefits and higher out-of-pocket costs. Some PPO plans require that you choose a primary care physician, a PCP. This PCP will help direct your medical care by deciding for you when you need additional treatment. And many PPO plans require you to get prior authorization before certain medical procedures, such as surgeries, are performed. Simply dial the telephone number provided on your PPO membership card and discuss the situation with the PPO's representative. There is another reason to stay in network. When you do, most PPOs require no claim forms. What a relief that can be. Remember, many PPOs require prior authorization before certain medical procedures can be performed. When you use services within the PPO network, there are no claim forms to fill out. If you want reasonable premiums, quality health care, and freedom of choice of providers, your preferred provider organization is the health plan for you. Your point of service open access plan. Most managed healthcare insurance programs require you to choose a primary care physician, or PCP, to act as your professional healthcare consultant. It is the job of your PCP to manage your overall care, to quarterback, if you will, your healthcare needs. And if you ever require the services of any other healthcare professional, your PCP will refer you. If for any reason you make the decision yourself to seek the services of another healthcare specialist, if you choose to ignore the quarterback and run your own play, in most cases, your level of coverage will be significantly reduced. Your point of service or open access plan is different in that it allows for you to self-refer, to basically decide for yourself which healthcare professional you should consult. There are several different types of point of service or open access plans, but most are similar to other managed care programs in that they encourage you to do business with healthcare providers who have contracted with the plan. These providers have usually discounted their fees to the plan in exchange for having more patients referred their way. These providers, those who are participating in the healthcare plan, comprise a provider network. Whenever you consult with one of these providers, you are considered to be in network. Whenever you consult with a provider who is not participating in the plan, you are considered to have gone out of network. POS, or open access plans, encourage you to do business with providers who have contracts with the plan. Most point-of-service plans charge you a small co-payment whenever you see a provider who is in-network. There may not be an annual deductible, and there probably won't be any claim forms or other paperwork for you to complete. If, however, you go to a provider who is out of network, you most likely will have an annual deductible to meet, and you will have to complete claim forms in order to get a percentage of the claim cost reimbursed after you exceed your deductible. Regardless of whether or not you consult with providers who are in the network, point-of-service plans allow you to self-refer. You decide when you need to consult with someone other than your primary care physician. Remember, though, that it is certainly in your financial best interest to consult with a provider who is in network. Your benefits will be substantially higher if you do. POS or open access plans offer you freedom to decide which doctors to see. Choosing a doctor in network means lower co-payments, no annual deductibles to meet, and no paperwork to fill out. Open access plans also allow you to self-refer, to decide for yourself when to consult with a provider. And like point-of-service plans, open access plans financially encourage you to seek medical attention from providers who are in the network. However, many open access plans differ from point-of-service plans in that they usually offer no benefits if you go to an out-of-network provider, except in cases that are deemed to be emergencies. Using out-of-network doctors usually means no benefits. So, if you have an open access plan, make sure you refer yourself to an in-network provider or you are very likely to find yourself out of substantial dollars. If you want flexibility and the freedom to decide when to seek out specific healthcare providers, you'll appreciate your point of service or open access benefit plan.
I think it does help me to kind of try and get more details into my head and try to form like more conclusions out of things. So yeah, it kind of makes me a better thinker.
It's helped me be a critical thinker about thinking how other people act.
This course could help me with like other problems because we can solve the issue ourselves, like between one peer and another, and not just go to someone else and have them solve the problem. It'll help us do our own thinking.
I think they had to not only be a critical thinker, but be an active listener, which is one part of this curriculum I liked, because they had to listen to their partner, they had to listen to their group.
Courses like this usually make me think because I get to be all open and stuff and talk about what I feel and what's going on.
When I participated in this process, I mean, I really started actually like getting interested. I mean, at first I was kind of like, I don't understand the big deal, and then when I got like into this, it kind of was like, wow, this is like a really big deal and we need to do something about it.
It's helped me become a better thinker.